Yes, we are live on YouTube. We are live on Instagram. Welcome. Today, I have here the wonderful um, keto coach, Daniel Sales. He's also an emergency medical technician at EMT. And I'm so excited to have you here today, Daniel, so that we can talk about this topic that is super important to me. So, hi, everyone, and welcome to Divine Healing on Demand. I'm your host, Kiana Del Rey, the chronic illness coach. And today we are welcoming Daniel to speak on patient advocacy, self advocacy, and the importance of how to speak up so that you feel heard by your doctor. So, I'm so excited to have you guys here. So, one of the things I want to talk about today is something that a lot of people don't know about. A lot of people are arguing about this, but it's fact. It's well documented in the research that there are healthcare disparities in the United States. So, a healthcare disparities, what is that? So, healthcare disparities are differences in access to or the availability of medical facilities and services and variation in rates of disease occurrences and disabilities between population groups defined by a socioeconomic characteristic such as age, ethnicity, economic resources, or gender, or even populations identified geographically. So, this is a phenomenon that we see out there. People receive different types of healthcare based on their socioeconomic status. That is something that is undeniable at this point. And I have Daniel here today to kind of talk about some of the things that we see when this happens. And the biggest thing that I feel that most people see is that they feel unheard when they go to the doctor. So, Daniel, how are you today?
Doing good, doing real good. How about yourself?
I'm doing great. I am just super optimistic and excited to bring people this information that is so desperately needed.
Yes, ma'am. Yes, ma'am. I'm excited. Thank you for having me. I'm just like I'm giddy. I'm ready to go.
Right? It's so exciting. I believe that we are saving people's lives today because we're providing them with information that will help them advocate for themselves when it comes to talking to their medical professionals, which may in fact save their life one day. I can say for myself that I was in the ER back, it was April 19th, 2021.
Mhm.
And I went there and I was like, y'all, my heart's acting up. And they were like, oh, honey, it's probably anxiety. And I was like, oh, honey, I'm pretty sure my heart's messed up. And
Yeah.
it turned out that the doctor, she even got rude with me and was like, you can take my medical opinion or leave it. And it turns out something was wrong with my heart, and I got to take beta blockers every day. So thank God that I fought that lady in the ER. I had enough strength to fight her and be like, you need to check again. Because if I wouldn't have done that, they would have sent me home with a heart condition and on no medication, which could have
Oh
been
wow.
extremely problematic. So it's really important that we do this. So I want
Mhm.
to ask you, Daniel, from your perspective, what are the biggest disparities in healthcare and how does it impact patient care?
Some of the biggest disparities with patient care that I understand and feel. Oh, I got feedback from this thing over here. Ooh, I'm trying to mute myself so that way I don't overload my sound. There we go. I think I'm good now. All right. Some of the main things that I've experienced and seen as far as disparities, you have providers who have their own implicit biases based off of either belief systems or, their own cultural backgrounds. I've seen it picking up patients in the ambulance. You have the paramedics and the EMTs there, just they'll judge a, judge a patient by the location of where they live, if they live in the quote unquote hood, or by the economic background. I've seen it to where the level of treatment is basically different based off of who they pick up. Especially speaking from the ambulance perspective, I've had to stop a couple of the people who I work with and be like, "Hey, mm-mm." A lot of times the patients, as soon as they come to see me, especially if they're frequent flyers, they've said to me, "Oh, I'm so happy to see you." Like, why? Because representation matters. With me, when I would show up, they will look at me and be like, okay, they give me more information. They'll talk to me, and then all of a sudden, my partner, after we drop them off, they were like, "Hey, I'm gonna need you to slow down." I'm like, "What you mean?" It's hard to follow you. They talk to you more, and it's hard for me to come in right after you after you've talked to them. They're like, "How? Why is that?" I said, "Because they trust me to listen to them. They trust me for when they tell me something when they're hurting. They trust me to understand that I'm not there to question it or judge it. I'm there to treat right there what you're calling and you're complaining about. I'm not here to make any judgments. I'm not here to be biased. In EMS, you see people at their worst moments. So you have to leave everything personally about you in your car before you get onto your box and go out there and get people. So you have to put those aside, but you have people who don't. And it's a lot more people who display those biases openly directly to the patients, even in from pre-hospital care. And I've even worked in orthopedic sports medicine and pain management. That was my most latest role. I was a patient supervisor, clinical supervisor, and a patient services manager. I've had providers, pain management specialists, spine surgeons when I worked for them and helped them out in their shifts, show that implicit bias against a black patient, black woman, black man trying to get pain medication, trying to, say, well, they kind of seem like they're drug seeking. I'm like, no, the man is in pain. Well, they could be saying that. You didn't see how I picked him up in the lobby. The man was sitting up there. He couldn't sit still. He was sweating. By the time I had to get him down the hallway, he was shuffling because he couldn't move. With areas that I palpated, and when I went in for my questioning on my initial contact, he broke it down for me, and I painted you the full picture. And the only thing that you got out of that was you think that he's drug seeking? Well, you never know. Based off my experience, I said, have you had this pain before? No. So how can you tell me? Well, and then they get in their feelings, and their ego is tested. Well, I'm the doctor. Right. You're the doctor. You've studied pain. You've studied you. I'm not trying to take anything away from you. Your certificates are on the wall, but you're not a doctorate over this person's pain. This person's pain is specific to them. We can tell if they're lying about taking medications because we have to do drug tests. If you're taking opiates by law, we have to drug test you ever so often to make sure that you're taking the medications as directed per the guidelines that the doctors specified. If you're not taking them, we gonna know. We're going to know. So we have the backups to make sure that we're doing to make sure that the patients are doing what they're doing. You don't need to judge a person based off of your conceptions or your biases because it does implicitly affect patient care. Patients won't trust you, and a bad review from a patient travels a lot farther than a good review. So yeah, it's out there. I've seen it firsthand in so many occasions, and when I say it make black people, and I'm gonna say that this from personal experience. Black people don't like to go to the doctor as is. Black men don't like to go to the doctor. I'm one of those men. I work in healthcare, but I am a horrible patient. I cannot stand to go to a doctor because one, I just don't like it. Because one, I don't feel like they're going to fully hear me, and I work there. I feel like they won't fully understand what I'm trying to tell them because the first thing that they're going to see is me. I have to get them past seeing the initial so that way they can see so that way they can treat my issue, treat my pain issue. And that should not be there. You should see the patient as their pain issue and treat that patient as a person with humanity and dignity. If they do wrong, they do wrong. You can't stop them from doing that. You can stop them if they do wrong after the fact, but you don't need to treat them as if they're a criminal or as if they're lying to you. They're not being honest with you when they're coming to you, paying you to help them. So it's a pandemic outside of COVID because it's rampant in the medical field everywhere.
Yeah. Oh, it's beautiful share. I can say firsthand that my whole experience being chronically ill is in not having, I have several diagnoses, like, so, I have several chronic conditions like asthma, hypertension, tachycardia, a coronary spasm,
Hmm.
PCOS, but I
Oh,
have
wow.
had
Okay.
bowel problems since 2013. No,
Hmm.
since before then, since I was 19. And I was seeing a PCP, but I was at Radford and I didn't have insurance, and I was a student there and I didn't have money, to pay. Well, it became such a significant issue that I was eventually referred to gastro, and they were
Hmm.
like, we need to do a colonoscopy. Well, I got this colonoscopy, and no one ever called colonoscopy and endoscopy, and where they look into the stomach as well. And
Hmm.
so I I received that colonoscopy, and I never got a call back. I never had a follow-up visit. I received a letter in the mail 3 months later letting me know that my biopsy came back non-cancerous. Hell, I didn't even know I had a biopsy. So I went
Wow.
in there furious, like, excuse me, I came here sick, asking you guys for help, and I don't know what's wrong with me. Like, what were the results of my scan? So I go in
Right.
there raising Cain, and I got met with a little bit of resistance. And the doctor said to me, well, you're going to need a colonoscopy, and you're going to need this, and you're going to need that. And I said, sir, I just had a colonoscopy last September. And his mouth he went from this to
Yeah.
shock. And he
Hmm.
turns into his computer and he looks for 2.5 seconds and he goes, oh, this is IBS. Fast forward 10 years, and I see a gastro a few months ago, and he was like, we're no longer using that label, because if this was just
Hmm.
IBS, this problem would have solved itself years ago with you
Right.
changing your diet, with you doing all of these things, but you're complaining the exact same problems as 7 years ago. And he was like, this is problematic. Something was missed on the scans. So they
Yeah.
want me to get another colonoscopy, but it's like, I almost don't even want to, because they didn't help me the first time. And it's ironic because there is someone who is a peer of mine. I respect her, and I won't drop her name here, but we were colleagues in the sense that we were going to college for the exact same thing. We graduated the exact same year. She was diagnosed with ulcerative colitis the
Mm.
same time I was seeking help for my bowel problems. She received help. I'm still begging for it. And it's sad because it was the same hospital system. We're in the same area, but she looks different than me. She came from private insurance. She had, enough money for her to at least care, for them to at least care about her problems. So I found that not being heard when I complain of issues, and I believe it's because of the way I look and my gender. I think being a woman on top of that sucks. Like, I think the fact that I'm Black and a woman doubly sucks when it comes to
Right.
going to the doctor, because they think I'm either crazy or like over exaggerating or making it up or drug seeking or whatever. And I'll tell them all the time, I'm in pain, but I'm not looking for you to give me any medication. So let's go ahead and say that right here, right now. I don't want any opioid medication. You can
Mhm.
pass me an ibuprofen or an anti-inflammatory, but let's go ahead and state that right here, right now. I'm not drug seeking. I don't want any medication from you all. I want answers. And I feel like when you come in there and you're like, like, drop the drugs right here, right now. I don't even want y'all to give me any. Tell me what's wrong with me. I feel like
Right.
they take you a little bit more seriously. But I found that no matter what, it just seems like the damn doctors just don't listen. And it's so funny because you and I had this conversation on another platform later, or I think earlier this week, where we talked about the study in the Journal of General Internal Medicine, where it showed that doctors interrupt their patients during appointments, and most patients on average get 11 seconds to speak without being interrupted. 11 seconds.
That sounds pretty close to being accurate because okay, so on the medical assistant sketch doctor's office scheduling part of it, a lot of time. Okay, so I'll speak for in regards to the practice that I was at prior. They usually had 30-minute slots for new patient appointments. To where one, if they got to do X-rays, labs, or anything like that, then they can use that 30-minute area to go ahead and work on based off of what they initially see to set up somewhat of a treatment plan, or if they need to do a procedure XYZ. Established patient visits are only 15 minutes. Some of these providers that I was in the facility that I was with see about 60 to 70 patients a day. So they're coming in, they're in the room for probably not even 15 minutes, and then they're out, and then the next person's in. It's a constant revolving door. That is not adequate time to reevaluate. And I know, and I know, and I know because I've seen it, that patients are like, I got questions. This procedure didn't work. I need to know what's the next step. And that's something that's not going to take 10 to 15 minutes. But that provider's trying to stay on that schedule so that way they can get patients in and get patients out. Whether or not they address all your issues in that time period, they're still going to bill you. That's the sad part. They're still going to bill you. Now, to kind of say something in regards to what you experienced, and I want to address that real quick because that's something that's also extremely common. A minority, quote unquote, woman without insurance, they're probably not going to show as much attention or detail or follow up with. Why? Because they're going to expect payment. They're like, well, she can't pay. We don't need to get her back in, even though they may need to. Well, definitely in your case, you needed to. Because anything that's more than just something that's problematic is chronic. And when it's chronic pain, come on, I worked in pain management, literally. When somebody says that they've been in pain for years, believe them. And that's something that needs to be addressed. If not, the second that you get the results, it need a follow up. Honestly, to tell you the truth, you should have had a follow up within 2 weeks. Definitely to go over your results, to lay out a treatment plan, and if need be, to follow up with somebody, at least get you. If you didn't have an insurance, you're supposed to be set up on a payment plan or payment arrangement, so that way, one, you can be treated for what you need to be treated for, and not have to break the bank. But providers don't. A lot of doctors don't think like that. Unfortunately, they're thinking about patients as co-pays, deductibles, co-insurance. Did I make sure that their billing is going right so that way one they can go ahead and get their money for that encounter. Whether or not that you get the care that you need, at least we bill for that encounter. And then we'll follow up with her if we need to. X, Y, and Z. But that's derelict in their duties and responsibilities as clinicians, as providers, to render that extra provider care. Because guess what? You would have had to come back and you would have had your itemized list of, I need to know what I need to do. Bump the meds. I need to know what I need to do. Because if it's something that I can fix, tell me what I need to do. Print out the documentation, give it to me, highlight it, whatever. Get your medical assistant, CNA, highlight it, and get it to me so that way I can go take care of me. That takes more than 10 to 15 minutes. But these providers are trying to get people in and get people out so fast to where they're seeing people, to where they're getting that revenue up for the facility that they're at, because they have metrics that they have to meet too, which is ridiculous. They have to meet so many people. They have to be accumulating so much in their overhead so that way, one, they can pay their staff. And this is the manager part of me speaking. So that way, one, they can do all this X, Y, and Z. But I'm like, as much as you pay these doctors, because I don't know a doctor that's not making more than $80,000 to $90,000 a year, and the providers that I knew were clearly millionaires, easy. Some of them were showing up to work in their $95,000 car. So you're sacrificing patient care so that way you can have volume. It's not right. Because so many things are being missed. So many things are being missed. I wish I could tell you the names of the patients that even one of them calls me on my cell phone because she knows my number, because the only way that she can get the doctor to listen is if she called me. She had to call my personal phone with my Google Voice number. So that way, one, I can relay the information to the doctor. And he knew for a fact that if she had to call me, that means that means his medical assistants weren't doing their job to relay the message. So he was like, "Oh, it's her?" I said, "Yep. So what she need?" Oh, well, you already knew. If I had to come to you and tell you what the patient needed, that they didn't already try to get to your staff, and your staff ain't doing what they need to do. Because when I was part of his staff, oh, he hated it because the patients always called because they knew for a fact I would listen. Because that goes back into my training as an EMT. I'm trained to listen before because I need to know everything of what's going on so that way I can adequately get you stabilized for transport. And plus, that's just me. Period. I'm that person that cares about people. I care about what I do. It's not just a paycheck for me. You know, It's not just a paycheck for me. I genuinely care about people because I don't want to see people suffer. When you don't want to see people suffer, you want to do everything that you can to help them, and it doesn't matter how much time it takes, as long as you get the results that you need for the patient. And a lot of providers, and I know I'm going back in the rabbit hole, a lot of providers are missing that. I can't stress that enough. Providers nowadays are missing it because they're worried about volume and billing. Because think of, can I go down another rabbit hole real quick?
Go for it.
Okay. Do you know how much it costs for a regular office visit?
I don't.
Okay. So generally, a normal office visit may cost anywhere to from $300 to $500. That's what's billed to your insurance. Now, your insurance, now, if you have a copay, you're usually just paying your copay and your insurance covers the remainder amount after they make deductions for Medicare and all that other stuff. But still, those providers are still walking away with approximately $250 to $300 per person. Now, imagine if they're seeing 60 to 70 people a day
Damn.
at
I should have went
at
to medical
200
school.
at $200 to $300 per person that they're guaranteed to get paid by insurance. So they're not trying to, they may be trying to help people. I don't know too many providers who are seeing 70, 80 people a day who are giving great, awesome patient care, in those time periods. But I know for a fact that they're cleaning up. I know for a fact that they're making a lot of money. Hell, I've seen some of the reports on what they were making. I know that they're making money, but I also got all the complaint phone calls. This provider didn't listen to me. This provider doesn't do this. This provider didn't, his bedside manner was horrible. He treated me like this. And I get these horrible calls. He had the nerve, and I've had some patients sit up here and yell and yell. He said that I was drug seeking. He thought I was drug seeking. He thought I was selling my medication. He told me this. And I'm like, please don't go for a lawsuit because right now you are in perfect grounds too. And it was my job to diffuse the situation so that way, one, those thoughts didn't come into mind. But this is the ugly side of things. They're collecting money from all these people. It's the volume is take there. And I'll say this one last thing, and I'll stop so that way we can move on. One of my good friends, he is a physician, an ER physician, and I believe that he's in Houston. And one of the things that he told me, he says one of the things that they told him in med school was how to get paid. That was one of the main things that they focused on in med school was here's a whole situation on how you get paid. So that way you can make sure that you get paid. And I get it. They're entrepreneurs in many sense. So you want to know how you get paid. But sadly, when they get to these practices and they start to learn how these other ones who game the system, it's easy to go ahead and kind of dive off into that realm to where some of those good-hearted doctors start to change. And we're losing a lot of those good doctors who care about patients who really don't care about getting paid because they got their monthly check is good enough anyway, but some of them really want it so that way they can put that down payment on that fourth house and that 10th car. But that's just me. I'm gonna shut up. Let's move on. I'm sorry.
Go ahead and speak the truth. I'm so glad to have your perspective as someone who has been at the forefront of this battle. And so the next question I want to ask you is,
Mhm.
who do you feel is the most at risk for these disparities, medical discrimination, and racism? Like, who do you feel like are the most at risk?
Low income, definitely low income people, minorities, and the elderly. I'll say because I look at it this way: the amount of knowledge of insurance is the same with the low income young demographic and the extremely aged and elderly. Those two groups know zero to very little information about how their insurance works, how what their coverage entails, what their financial responsibility is for anything, and they're if they go to the doctor, they just listen to the doctor without questioning anything because both areas don't know what to ask. Because either if you're extremely old, if you're a part of the elderly community or the geriatric community, then you've been taking medications for decades and decades. So you just like, look, I've been going to this doctor for so long, I just trust him. He gives me all this medication and I just trust him. And then the young generation, they're like, well, he just told me to take this, so I'm just going to take it. Not knowing that you can research the medication, ask them about side effects, because if you have an underlying condition and you take a medication that causes an adverse reaction, and guess what? Now you're in a whole bunch of trouble. Now you call 911 and I come pick you up in my light up box and take you to the hospital. And then if you're in the older demographic, then guess what? You may not know that you're not supposed to take so many medications. And sadly, our elderly community, they hold on to medications as well. Well, I haven't had to worry about taking this oxycodone for so long to where I just held on to it for so, and I just decided to take it because I was feeling pain all of a sudden. Me, mom, big mama, that medication's 7 years old. You got penicillin growing on your medication. When I mean penicillin, you got mold growing on your medication because it's that old. Well, I just held on to it because I had some extra. Lo and behold, you call 911. Will. Here I come showing up, cherries and berries in my box, ready to take you on to the hospital. So those are the main areas that are going to be severely impacted because the young people aren't going to know when they're being racially biased. And if they are being racially biased, they're not aware of what things that they can do to make sure that it doesn't happen again and to protect themselves and to hold those accountable. And the elderly people don't want to ruffle any feathers in many instances because they don't want to be cut off from their care because they're like, I can't, they don't know how to go find another provider because insurance changes all the time, and they may not have somebody that's in their back pocket, a family member who's understanding of the insurance to help guide them and direct them to where they need to be. Now I say that to say this: the middle, late 20s, 30s to 50s, we ain't got no excuse. We've had insurance for a while, most likely through multiple jobs and employers, to where we have no excuse to not know. To where if we're in this area now and we don't know, it's our own fault. And we shouldn't blame anybody else because I got those calls too. Well, I should have had this. You should have read your plan document. Well, I just got the cheapest thing. Well, if you get the cheapest thing, you get the lowest coverage. You get what you pay for. And that's the sad thing with insurance, but it's true. You get what you pay for. If you get what's cheap, and I'm not trying to fault anybody. I had to do it. I had to do it. I had to sit up here and as soon as you find out how much you're going to make hourly, the first thing that you start doing is when you get that insurance premium, you start calculating bills. And I'm like, okay, so yeah, I'm gonna need this one, even though it's a $7,000 deductible and all this other stuff. But it's only $40 a pay period, and I can make sure that these bills are covered versus paying $150 just for me. Having great coverage, but that's just $150 just for me. If I include wife, children, then that bumps up to $300 to $400 a pay period. That right there takes away from bills. So it's a double edged sword in many instances to where people are having to make hard decisions. But the main people, to answer your question, the youngest generation and our oldest generation are the most who are more susceptible to bias, racism, and manipulation and disrespect from the medical community because one, they're the most vulnerable.
Whew, laying down the freaking fire today from Daniel. Lots of fire today from Daniel. My next question for you is what do you suggest people do if they suspect that they're getting piss poor medical care due to discrimination?
Speak up. Closed mouths do not get fed. People don't, I'm a person who uses analogies so that way people can see exactly what I'm trying to say. People don't know if there's a fire if you don't tell them what's burning. You see what I'm saying? Well, I don't want to sit up here and worry about getting kicked out and not getting care. Think about it. If it's happening to you, it's happening to somebody else. And they may not have enough courage to stand up against the person and say something. By all means, speak up. If you're afraid of going to the doctor, if you're at a medical practice, go to the clinical supervisor, go to the clinical manager, the office manager, speak to them, file a formal complaint. Seriously, file a formal complaint. They have to take those complaints. In management, I've had to take formal complaints against doctors, and guess who those go to? They went to my clinical director, and then they went to my CFO's desk and my CEO's desk. They have to go there because these doctors have board meetings every week. And if enough complaints, if not the first complaint, the CFO, the CEO is going to bring them in and say, "Hey man, we got a complaint about you. Walk me through the situation." And then that doctor has to sit up here and they have to go and they have to speak up for what happened. Now they may try to paint you or in a bad image. Okay, so what? The biggest thing is you filed a report, and if they write it down, ask for a copy. Ask for a copy. If not, make sure if they don't provide you with a copy, you take the time and write it down. Don't just go online and Google and Yelp and put a review in. Write it down. You can also do that too, by all means, because you can also see exactly if they've already had complaints against that provider as well. But write a review. Write it down. Give it to those office managers. Give it to the patient clinical supervisors and managers. File a formal complaint. Turn it in. And if it continues to happen after that, because sometimes if they get that one complaint, they're gonna change their tune real quick because they know, like I said at the beginning, bad news travels a whole lot faster than good news. It travels. I'm serious. You'll find out 10 bad things about somebody before you'll find out one good thing about them. Promise you. But if it's the same thing for multiple people regarding one situation and treatment, more than one person is gonna be like, okay, hold on, something's definitely wrong here. Especially if the CEOs and the CFOs and all the people in the admin start getting the same complaint about that provider, they're gonna be like, okay, either you need to stop or we're gonna stop you and you can go find somewhere else to work. Because one, if the stuff continues and somebody decides to file a lawsuit, then guess what? You got all these other people that these lawyers are going to be looking into going like, hey, all these people filed complaints to you too, and y'all didn't do nothing about it. So y'all gonna make yourself liable, and I promise you, that's gonna cost them, not only the facility, the hospital or clinic, that's gonna cost them a whole lot of money, and that's gonna cost the doctors a lot of money. And one thing I know about these people, they don't like paying money to settlements. They like to avoid those at all possible costs. They try to avoid them as much. But you have the power. You're paying for a service. You see what I'm saying? You're paying money for a service. If the service that you're paying money for is crap, report it. And then don't pay your money there anymore. How do you get a
Correct.
doctor? How do you get a doctor to change what they're doing? You make them broke. You hit them in their pockets. Because once they realize that patients are not going to them anymore, they're gonna be like, "Ooh, I, they're gonna have to change something." If they don't change, okay, that's on them. You do your due diligence. Do not be afraid to report a doctor. They are people first. They may think that they're God because they make so much money because they have a whole bunch of certifications boarded up on a wall and they're a part of all this philanthropic and they got money. They may think that they're God, but they're people. You can humble a person real quick without ever having to raise your voice to them, without ever having to hit them or do anything. You can humble them real quick by just reporting.
Period, point blank. Period, point blank. Yes, thank you so much for saying that. And so the last question I want to ask you, I'm always talking about like how do we be the best patient advocate for ourselves? And so I want to thank you so much for everyone who tuned in today as we discuss patient advocacy and how to speak so that you're heard by doctors. Some of the pro tips that I like to give out is, using a symptom tracker app and keeping a record of your symptoms, knowing when it started, what kind of pain it was, logging that pain, how it felt, and how often you feel that pain, preparing your questions before the appointment and not waiting till the end of the appointment to go over them, making sure that when you're in the appointment that you're staying on message, telling the whole truth, and making sure that you rehearse before you go to the doctor so that you don't get nervous when you see that white coat and freeze up. And then being straightforward and asking open-ended questions with your doctor so that you can be honest if you're not being heard, saying things like, I'm worried that we're not communicating well, and this is why I feel that way. Making sure maybe not to go at it alone, but taking a family member or even a patient advocate or a friend. And if you don't feel heard, don't be afraid to make the switch. But I want to ask you, do you have any other advice about how to speak so that doctors will listen?
Maximize your time. Maximize your time. Just understand and know that they're trying to go ahead and keep to a schedule, but you're coming in there for a reason, so that way you can get clarification and understanding on what you need to do to make an informed decision about your health. Maximize your time. If the doctor's trying to rush and speed up, well, I got another patient. Okay, well, my appointment's not done and I have questions that I need to have addressed. I'm not going to call after I leave here. I'm paying good money. Please respect my time. Or as was it Maxine Waters said, reclaiming my time. Sometimes you just have to be like that, because if they're going to be so adamant about keeping to their schedule, you need to be adamant about making sure that you get the best bang for your buck. You're paying good money to get answers for your health. If anybody's serious about taking care of their health like I am, you need to be anal about making sure that you maximize your time. Don't be afraid. They're doctors, they're humans, just like you. They got a mother, they got a father, they got a cousin, auntie, a daughter. They have somebody that's in their life that they would want to make sure that if they were coming to the doctor's office, oh, they're going to be asking every single question under the sun and they're going to maximize their time. You have that same right. Don't give it up just because they're trying to do something for themselves. They signed up for that job. They knew exactly the hours. They knew exactly what they were getting into. You need to hold them to it. Hold them to it. There's respectful ways to do it, but definitely make sure that you maximize your time. And one thing that I can say, please, 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 if you do not have a current medication list, okay, this is one thing that I've done, that I asked everybody, all my family members to do too, since I've been in EMS. Make a medication list, type it out on Microsoft Word. Okay. You can either make it a whole page or make it small, whatever you need to do, but have a medication list. Keep it in your house. Keep one in your wallet. Ladies, keep it in your purse. So that way, in the event that you need to go to a doctor's appointment, you can just say, do you know what medications you're taking? Yes. Pat, here you go. So that way, one, they can have all your current medications. If anything changes, go back to Word, print it out, update it, and print it out. Keep it with you. That helps the providers, because a lot of times when you go into the doctor's office, a lot of people don't know the names of the medications. They don't know, well, I know I take this one for high blood pressure. I know this one I take for my thyroids. Just make a copy that you keep with you. So that way, one, you can provide it to them. So that way they can see everything. That helps with your appointment, and also it helps with your treatment, because now they know exactly what you're taking, so that way they can treat you properly. If you've had x-rays or anything else done recently, write it down, so that way they know that you've had imaging done prior, and that way they can already be looking for it. But if your appointment is at 9 o'clock, be there at 8:30. Please, people, please. I mean, everybody. So that way, one, you can get there early, take care of all of your paperwork, okay? Because sometimes it's a book and a half just to get through all your paperwork. And what's to say that that patient who, if you're scheduled at 9 and that patient who's there at 8:30, 8:45, what's to say that they didn't come? Now you can be seen earlier, and now you have more time. So that way, one, you can ask some more questions, get some more details or anything like that, or find any other recommendations that you need. Everything is about maximizing time. Everything is about maximizing time. The information that's being given is stuff to back you. It's stuff to back you for your benefit. So maximize your time. Ask questions. Bring somebody with you who may be more detailed in something that you're really, really wanting to know, or know how to ask it for you in case that you get stuck. And just don't be afraid. Don't be afraid. And especially once you leave, don't be afraid to call back and ask for a follow up, especially if you had a test or any imaging done. Usually they're supposed to make sure that you're scheduled for your follow up. So that way, one, you're already on the books while they're waiting for stuff to come back. Give yourself at least 2 weeks. If they haven't already set you up for a follow up, give yourself at least 2 weeks and call your office back and say, hey, I haven't heard anything. Can you guys let me know what's going on? Do I need to come in? So that way, if there's something that they can tell you over the phone, they can tell you over the phone. But honestly, go in. Go in. Because sometimes the medical assistant or CNA or nurse, whoever's may be there, may be new or may be inexperienced, they may be nervous themselves on giving out information, and they may give you the information wrong. This way, if you have any follow-up questions, you can get the answers directly from the horse's mouth. So give yourself 2 weeks from your appointment if you haven't got a follow-up, just to say, hey, I haven't heard anything back in from my tests. Have they come back? When do I need to come in for my follow-up? So that way we can go over the results and what the treatment plan is. All of this is getting information so that way you can prepare and set up your life on what you need to do. So I hope that helps. I hope that helps. I hope that helps. But definitely get your medication list printed out. Oh my gosh, I can say get your medication list printed out because I stop trying to guess. Pravastatin, ibuprofen, tramadol, you know, just just type it out, folks. Please, 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 please. It helps you, and it helps the medical staff, EMS, because even if EMS is showing up, they're gonna ask you what are you taking. If you just hand them the paper, they're like, yes, we can continue to treat. So that's just one of the main things. But do everything that you can to maximize your time. Thank you so much for having me today.
Yes, thank you for coming. So you guys heard it here first from Daniel Sells. He told us to make sure that we're maximizing our time in our doctor's appointments, not being afraid to speak up and ask questions, and coming prepared to our appointments so that we can get the best care that we can and we can advocate for ourselves. So thank you so much for tuning in today. And if you're ready to start self-healing from your chronic illness through natural remedies, non-toxic living, and nutrition, feel free to book a strategy session with me. I'm Kiana Del Rey, the holistic healer and chronic illness coach. And don't forget to follow or subscribe to this YouTube channel. I loved seeing you guys here today. I loved having you here, Daniel. Thank you, thank you, thank you.
Thank you. I'm so excited. I'm just
Follow
cheesing.
you.
I'm like, we can like go on for like days on this. I can like just touch so
We'll
many. You see
have
the
another
seriousness.
we'll have another live on insurance, and I'm a licensed insurance agent, so we can get into it.
Oh,
So
let's go. You see the seriousness in his face, right? Like the whole TI mode expeditiously is like just running in my mind right now. I'm like, this is I'm excited. Thank you so much for this opportunity. I truly appreciate it. Thank you.
I'm so grateful to be connected with you, someone who can give us the deets on how to really advocate for ourselves as patients. So thank you for being here. Thank you for all the wonderful information that you provided. I'm going to send you a copy of this replay so that you can post it wherever you want. And I just want to thank you for being here. Please do follow Daniel at Keto 911 podcast on Instagram. And he is amazing. He's lost so much weight with doing the keto diet. It's a great story. Please follow him. Thank you guys for tuning in today. Thank you, Daniel, for showing up. And I will see you guys next time. Bye.
Bye.